This section will summarize scenario models. Scenario modeling allows decision makers to examine a range of hypothetical what if questions and possible outcomes, often over the medium to longer term future. Recall that different types of qualitative assessments and modeling outputs are useful at different horizons. In comparison to short-term forecasting, which focuses on projections over days and weeks, scenario modeling can be useful on longer time horizons, including months into the future or even the past. Scenario models compare different potential futures or pasts, illustrated here as different lines representing separate models, each with different assumptions. Scenario modeling explores possibilities into future months and can estimate longer-term disease burden under hypothetical scenarios. This is useful to explore the potential impact of policies or interventions, as well as things that are unknown, like if new disease variants emerge with different levels of transmissibility or immune evasion. Types of input that would go into a scenario model depend on what scenarios you are trying to compare and your assumptions. This could include surveillance data, vaccine effectiveness, vaccine uptake, variant immune escape properties, or information about other interventions. Importantly, these can also be used retrospectively to compare a counterfactual situation to what actually happened, which is often very useful to compare the relative value of different public health intervention options. Scenario models are particularly useful to help answer what-if questions about hypothetical scenarios we create based on assumptions to compare. For example, what if there was better or worse vaccine coverage? What if we required infection prevention interventions like indoor masking or not? What if people behaved differently and decided to test more or test less, or reduce contacts versus not? You can also explore biological what-if scenarios, like what if the vaccine matches the circulating variants more or less well? Here's one example of how scenario modeling can be used in a public health application. This example is from CFA's Respiratory Disease Season Outlook from the 2024 to 2025 respiratory disease season. In this figure, you can see there are two scenarios highlighted, Scenario A in dark blue and Scenario B in light blue. Each scenario is predicting what could happen for the number of weekly COVID-19 hospitalizations for the 2024 to 2025 respiratory season, depending on the unknown size of the summer wave. As you can see in Scenario A, the dark blue color, if the summer wave is lower, this would likely result in a higher peak of weekly hospitalizations for COVID-19 during the respiratory season, indicated in the gray banded section. However, on the other hand, if the summer activity were higher, like in Scenario B in light blue, this could result in a lower peak during respiratory virus season, possibly due in part to more population immunity from the higher summer peak. Scenario models can help scope potential outbreak scenarios and incorporate impacts of mitigation measures.